Hello everyone, I am Dr. Prachee Kulkarni, fertility specialist, Ferty9 Fertility Center, Banjara Hills. Today I will talk about recurrent miscarriages or recurrent pregnancy loss or habitual miscarriages. Many couples struggle with this problem, but they do not think that it is important to evaluate this problem so that they can have a healthy baby. So today I want to guide about this issue of recurrent pregnancy loss. So what do we do in recurrent pregnancy loss? We evaluate the couple completely for the cause of miscarriage. Also, every miscarriage may not be because of the same reason, so it is important to do the complete evaluation. So what we do is we do a pelvic ultrasound along with 3D sonography to find out if there is any problem with the uterus. So what problems of uterus can cause pregnancy loss recurrent is either septate uterus or unicornuate or bicornuate uterus, or sometimes submucous fibroid of the uterus which is going inside the cavity. So these problems we can diagnose on pelvic ultrasound and 3D sonography. Then what other tests we do? We do multiple blood tests for the couple to see if they have any other issues. Like for the wife, we will do thrombophilia panel. We will also do some autoantibody evaluation to rule out any autoimmune factor which is causing recurrent pregnancy loss. Usually patients who have thyroid problem may have autoantibodies to thyroid like anti-TPO antibody or anti-thyroglobulin antibody in high numbers. So this can also lead to miscarriages. Other factors how we evaluate is the blood test, which will tell us about endocrine factors like your thyroid hormone level or also your blood sugar level. So thyroid hormone level, if it is very high or if it is very low, also can cause miscarriages. Then what can be other test is genetic evaluation. Genetic evaluation, what we do is couple karyotype. Sometimes if the couple has come with a miscarriage, we may send the tissue of the miscarriage or pregnancy tissue for evaluation for genetic reason, that is called as CMA, cytomicroarray of the products of conception. So these tests we may do for genetic evaluation. Couple karyotype, suppose if it is normal, usually then we will look into other factors. But if the couple is in consanguineous marriage and if they have family history of miscarriages or if they have family history of some genetic disorder, then we may advise couple to go for whole exome sequencing. Based on the report, then we can guide them further for planning pregnancy. So this is about the genetic factors. Then on clinical examination also we can rule out causes for miscarriages like per speculum examination. Some patients may have recurrent infections which are in the form of vaginal discharge or burning in the urine. For on speculum examination we may see some infection, or we may also send the high vaginal swab for culture to rule out any infection. And we also check for the cervical incompetence, that is the mouth of the uterus. If it is too loose or if it is too short, then that can also be cause for miscarriages. So these tests we do for evaluation of the miscarriages. Some very rarely we may also ask a husband to undergo a sperm test, and also for the DFI. DFI is DNA fragmentation index. Suppose if somebody is having very high DFI, that can also lead to miscarriages. For such patients, then we advise to go for IVF with sperm selection techniques. Somebody who has genetic issue which is causing miscarriages, for such couples also we may advise to go for IVF with PGT testing of the embryo, that is pre-implantation genetic testing of the embryo. So what we do in PGT test is we take the embryo biopsy and we send it for genetic analysis to know if the embryo is normal. If embryo is genetically normal, we transfer that embryo. If the embryo is genetically abnormal, we discard those embryos. We do not use those embryos for transfer, so that your chances of pregnancy and having a healthy baby improve. So PGT can be of different types, like PGT-A for couples who have aneuploidies, or for couples who have recurrent miscarriages without any history of RPOC being tested, we can advise them to go for PGT-A. For couples who have history of genetic diseases in the family or who are in consanguineous marriage and we found to have some problem in their whole exome sequencing, those couples can consider the option of going for PGT-M. Couples who have abnormal karyotype where we see structural rearrangement causing balance translocation, we may advise to go for PGT-SR. So based on your evaluation, we advise further. For immunological problems, we give some medications either in the form of tablets or sometimes even in the form of some salines or injections during the pregnancy and also before the pregnancy. So, this is about the immunological problems. For couples who have problems with the uterus like submucous fibroid, we advise to undergo a surgery to remove the submucous fibroid. Somebody who has a septum, we may advise undergoing septum resection surgery. So, based on what is the cause for your miscarriage, we advise you how to proceed further. So, what may happen if you don't investigate your recurrent pregnancy loss? So, you may end up with more miscarriages. So, as and when the miscarriages continue happening, what may happen is it can damage your uterus, it can lead to infections, it can cause damage to the lining of the uterus. Leading to thin endometrium, which is not able to then accept the pregnancy, or sometimes it may also cause intrauterine adhesions, which we call Asherman syndrome, so that the inside of the uterine cavity is completely obstructed and it will not further accept the embryo. Sometimes even when you are having a procedure to remove the products, there might be procedure related risk like perforation of the uterus, or if suppose this infection happens in the uterus, it may advance through the tubes and can lead to blocked fallopian tubes or hydrosalpinx and pyosalpinx. So having recurrent miscarriages is not a good thing. You should get yourself evaluated to prevent complications related to pregnancy loss, and definitely with proper guidance and treatment you can have a healthy baby. If you are suffering from recurrent miscarriages, you can consult me. I am Dr. Prachee Kulkarni, fertility specialist, Ferty9 Fertility Center, Banjara Hills. Thank you.